Hey class of 2023, congrats on starting your PT journey during a pandemic, but rest assured you are in good hands, and I hope you have as wonderful an experience at UNT Health Science Center as I did.
Let's talk about clinical rotations.
So for clinical experiences day to day, that could vary. For me, I tended to observe during the first portions of it, and then slowly over time it was flipped and I was doing a lot more hands-on.
With the exception of my first rotation, by the end of all of my rotations, I pretty much had a close to full caseload and I was working fairly independently. Of course, my instructors were always there if I needed any help or feedback on, any skills I needed to work on.
In my case, I was starting to treat patients at the end of day 2 with my CI in the room and helping me, and then by the end of the second week she had transitioned to being outside the room for most of the patients. Obviously, if there were more complicated patients, there was no problem at all with me asking her to help me with them.
For choosing clinical sites, they'll go into that into more detail, but part of it is random and part of it you have control over. So going into it, I would just suggest being flexible as you can, but also knowing the things you really want and communicating that with Dr. Schwartz.
I moved for almost every rotation and did a combination of Airbnb for housing and, relying on friends that live in the area to find myself a spot.
So for housing, I personally chose clinicals that provided housing in some way, so I could put everything into storage for my last year or with my family. And then just kind of move between my rotations and stay at friends' houses or my family between them. It was kind of difficult living on a bag, but I happened to be lucky and it all worked out in that sense.
Is there anything you wish you would have done to be more prepared for clinicals? Honestly, the sites know that you're a student, and for your first rotation, they know you've only done half of your didactic work. So you don't have to worry too much. They know you're not an expert.
For me, my most powerful learning experiences were things that I hadn't expected to learn. I chose a good variety of clinicals, and because of that, I was exposed to international healthcare, pelvic health, outpatient neuro, which I hadn't expected. All those things gave me different skills that I feel moving forward will really help me as a clinician.
Did clinicals make you realize how much you don't know, or alternatively, how much you actually do know? Yes, to both. A good clinical instructor, which I was lucky to have, made me feel super smart and never made me feel stupid about the things I didn't know. And there were a lot of things I didn't know. But that's why you're in clinic. That's why you can't be a DPT without clinical experience. You're there to learn.
Clinicals do help you realize what your weaknesses are and the things that you need to work on, and it's really important for you to own those weaknesses and be honest with yourself about what your strengths and your weaknesses are. Clinical instructors really appreciate it if you're, willing to accept responsibility for mistakes and for your learning process and to be really proactive. More than knowing everything and being a perfect clinician, they just want to see that you can have the ability to grow and recognize what you need to work on.
I feel like clinicals, you feel like you don't know anything, and that's natural. That's part of the process. So going in knowing that and being open with yourself and gentle, kind, because we're our biggest critics. And then moving forward, there are things that you'll know really well, hands-on techniques, but you also learn as you go. So by the end, on your final clinical, it'll be totally different. And if it's a clinical over things that you don't know, you may surprise yourself in how quickly you're able to learn them because of your process as a student and a clinician.
Did you ever find yourself surprised to enjoy a clinical site that wasn't your first choice? I thought that I would immensely dislike outpatient ortho. It wasn't my strong suit, and I just didn't think I would like it. But it ended up being the rotation that I look forward to going to every day. And my CI from outpatient ortho is one of my mentors, and I've met up with her a few times since then and talked to her about different career options and what I can do, and she's fantastic. And it's one that, because it was my weakness, it was one that I learned a lot during, and it became not so much a weakness. So just if you go into it knowing that you're there to learn, you'll hopefully have a CI that's going to work with you and help you grow as a PT.
The other thing clinicals teach you is the settings that you really enjoy. So, say you try a setting, say you try acute care and you don't love it. That's okay. Don't force yourself to love it. It just shows you what sorts of jobs to look for in the future and what your personality is well suited for.
Right, class of 2023, good luck. Crush it. I wish you all the best, and in 3 years you'll be where I am now, graduated and taking your boards. All right, best of luck, and I'll be your colleague soon.